This is how to remove a nasogastric tube. I will begin by checking my patient's orders. I need to have a PCP order to remove the nasogastric tube. I would need to gather my supplies to enter the room. I need to have a patient basin, which probably will be in the patient's room. A cup of water for mouth care, my syringe, and some water for a flush, a non-sterile drape to place on my patient, and my gloves. I also have swabs for mouth care and a pen light to assess his nares after the procedure. I will enter the room. I'm going to wash my hands and introduce myself to my patient. I'm going to check my patient's armband and ask him to state his name and date of birth. I'm going to explain to my patient what we're going to be doing today, that we're going to be removing this NG tube, and it won't be quite as uncomfortable as it was when it was placed. I want to place a non-sterile drape across my patient's chest just to keep the gown clean, and I will give my patient a basin. I want to check placement before I remove my NG tube. I will check placement of my NG tube by using the air bolus method. Taking my syringe, I will draw back to 30 mL of air. I will unsecure my NG tube. I'm going to pinch it and remove the cap. I am going to instill the air and listen for the whoosh. And I know that the NG tube is in the correct place. I will replace my cap. I'm going to instill 30 mL of water into the NG tube. If the tip of the nasogastric tube is adhered to the inner lining of the wall of the stomach, this will loosen it so that when I remove the tube, I'm not going to tear the mucosal wall of the stomach and cause bleeding or irritation. I'm going to clamp my NG tube, remove my cap, remove my plunger from my syringe, and attach to my nasogastric tube. I will add my 30 mL of water, and raise the tube and the syringe above the patient and allow the fluid to instill. Once the water has been instilled, I will clamp my tube, remove my syringe. Now I will instill 30 mL of air in my NG tube to clear my line of all fluid so that when I remove my nasogastric tube, my patient does not aspirate on any of the fluid contents that are in it. Now I will unclamp my tube and instill my air. And I will remove my syringe and place my cap on the end. Now I'm going to remove the tape from my patient's nose gently. And I'm going to ask my patient to take a deep breath, and I'm going to start pulling gently and removing the tube and placing it in my drape, and I will discard in the trash. I want to take my pen light and do an assessment of the nares in the mouth and make sure that everything is intact and patent. Now I will perform mouth care on my patient and allow him to have water if orders are allowed for fluids. Now I will assist my patient to a position of comfort I'll put the bed in the lowest position and put his head back. I will now discard my supplies, remove my gloves and my personal protective equipment, and wash my hands.